The Delta variant is in many ways deja vu all over again. This is just another variant of a virus, and we know how it spreads and what will happen. President Biden is reported that he's going to announce soon that all federal employees must be vaccinated or get tested. New York State is doing the same. And we're working with our unions to implement this quickly and fairly. But we want to get it done by Labor Day. And I encourage all local governments to do the same. It's smart, it's fair, it's in everyone's interest. But we have to go further. And New York led the nation in going down the path that made the most sense, even though it is hard. And this has been the frustration for this country from the beginning. Politicians don't like to suggest actions that are not popular. A politician who suggests too many unpopular options is not a long-term politician. But there's a choice of doing the political thing or doing the right thing. And I've always chosen to do the right thing. And I believe ultimately that is even the best politics. But I think we have to go further here. I think we need dramatic action to get control of this situation. So in New York and our state hospitals, all patient-facing healthcare workers must get vaccinated. There will be no testing option for patient-facing healthcare workers. That is a point of contact that could be a serious spreading event, and we want to make sure that those healthcare workers are vaccinated, period. If the numbers continue to go up the way they're going up, I think school districts in those affected areas should strongly consider taking more aggressive action. And it will be hard. And I understand the politics, but I also understand if we don't take the right actions, schools can become super spreaders in September. It will happen. We have seen it happen before. And trepidation and politics that stops aggressive action feeds the virus. The virus feeds on our lack of action and on our apathy and on our fear. Schools in September will be places of congregation, and they can be super spreaders, especially when you put it together with the fact that you already know you have a high concentration of infection in those targeted areas. I also encourage the FDA to issue final approval of the vaccine. This vaccine right now is under something called emergency use authorization. Under emergency use authorization, states are limited as to what they can mandate. Once the vaccine is finally approved, then the state has more legal authority to mandate the vaccine.